1, 2, 3, 4, 5. Your T5 and then T6.
5.
5 right there. Okay. Where do you feel the upper back, mid back pain at? Can you
like
point to where that?
right here.
So you're talking about right dead on, right
Yeah.
between the shoulder blades. The lower back, you said it's both hips, right?
So it starts kind of like trickles.
Okay, but it starts from the center and then it goes from that side.
Yeah.
Okay, and you said that it was a couple years ago, or when did you fall on the black eye? It was recent, right?
January 2021.
Okay, but this started recently, probably within like the last couple months that you started feeling the back pain?
So with actually.
Okay.
No more than 6 months.
No more than 6 months ago. Okay. All right, well, let's take a look at you. Let's see what's going on. So each time, even though I scan you the day before, scan you the couple days before, we're going to scan you each time you come in, so I can see how your body is progressing over the time. But I want to see change, so I want to take a look at how your body is adapting and shifting and moving here, okay? All right. Yeah, right there. Okay, so we're going to be looking a lot at that lower neck here. How do you feel usually in the shoulders? Do you get tension, tightness in there?
Yeah, I just feel like I need to crack something or stretch it, and I can never stretch enough.
Yeah, yeah. Well, it makes sense with those x-rays now that we look at those. Yeah, and it's really important just to be able to look at those x-rays, because you can look at someone like yourself where it's like, you look fairly healthy, things are looking pretty good. But unfortunately, if we don't take the x-rays, a lot of times we miss a lot of the information here. But there's a lot of stuff that sometimes we'll catch where, there's just things that are not quite right. Even if from the outside they look fine, but on the inside it tells a little bit of a different story. Yeah, right there. That's where you're feeling that. Let's see here. Yeah. Okay, that's where we're going to be looking at. So, let's see which one we're going to be taking a look at. So, this is going to be 1, 2, 3, 4. So, your C6 right here, C7, 6. I'm going to go up to C5.
Oh.
That's where you're feeling that? Okay. Yeah, C5 is actually the one that looks like we're going to need to work on the most here. Yeah, and that's right underneath where it kind of curves back. So where your spine kind of curves this way, where it goes backwards, that C5 is like that fulcrum point right there. So we're going to see if we can move that guy forward, see if we get some pressure off of there.
Okay.
All right. 1, 2, 3, 4, 5. Your T5 and then T6.
5.
5 right there. Okay. And then we got your sacrum here. And this is where the x-rays really do help us here. That sacrum looks like the one that we're going to be working on the most here. So right there, here's your S1, your S2, and then your S1. Any sort of S1s a bit more? Okay. All right. Just take a look really quickly, a little bit more about how that's moving. So just so you know, when we do the adjustment, every joint within your body has gases in the joint, right? So whether it be your knuckles, your toes, your knees, your spine, those joints have gases. So when we move that joint, it can shift and have that popping noise. It's those gases that get released out of there, and then they get reabsorbed eventually, which is why you can crack your knuckles over and over, right? So let's get you checked out. Let me just take a look real quick here. Yeah, it doesn't move as well to that left. Alright, so this is your C5. We're just going to let your head just relax right there. And I'm just going to go ahead and push that spine forward just a little bit with that left hand. I'm going to stabilize you with the right hand, okay? So as you hold There, you're gonna relax your left shoulder. There you go. And just look up a little bit. Nope, a little tight. Let it go. There it is. Good.
That's funny.
Nice. Good. So this is your sacrum or your tailbone. I'm gonna roll you just a bit. I won't drop you.
Okay.
There you go. Let that drop. There you go. Relax that shoulder. There you go. Nice. Good.
Okay.
Come on up. Good, good, good. Here's that 5, 6, and then 5. 5's the one, right? Okay. Let's take a look here. Yeah, so this is where your spine starts to lean over to that right side. We're going to see if I can close that down and get your body to lean over to that left a little bit, okay? Alright, relax your arms down to the side. There you go. Breathe in for me. And then let it go. Drop those shoulders. Good. So, that's a good start here today. I'm excited about that one. Let's see how this one's doing here. Yeah, that's good. You start to see that disc space starts to become more leveled. Instead of where you're seeing where it's kind of smaller in the back a little bit and it's actually a little bit wider in the front. When that starts to become more leveled or flat, that means that sacrum, it's slipped back, and when it slips back, it makes that disc more parallel. And that's what we want to try to push that spine forward so we can start to get some pressure off of that lower back, and hopefully we can stabilize that foundation here, okay? The other thing that we did was we did your T5, that's your mid-back right here. So again, your spine's going out to the side, and it's trying to get a lot of the stress to come back over to the center, but we try to help that out over here, okay? The last one that we did was your C5. Again, that's where your spine starts to go back like this, and it's putting a lot of stress on the base of your neck and onto your shoulder. So hopefully we're going to try to get that spine to push and move forward, and hopefully that's going to get a lot of stress off of those neck, the shoulder and the neck here, okay? It's going to take us some time, but over a period of time, the more we can get that joint to be where it needs to be, the better you're going to start to feel, okay? So real quick, how are you feeling right now?
Good.
Good?
Good, yeah.
All right, good. Okay, so walking, now that we're getting those joints to move a little bit better, walking helps that process to continue, okay? The work done here, it continues as you go outside the office. So as you walk, those hips will start to move, those joints will start to move. It's going to help to flush out some of the inflammation, okay? Ice is your best friend as well. So if you feel any soreness, any achiness, ice helps to reduce the inflammation. So ice 20 minutes every couple of hours if you need to. And then water. How's your water intake? Okay, so we need to increase that. So if you can drink more water, they say roughly about like half your body weight in ounces is what you want to shoot for. So if you're not drinking that, try to get up to that. You know, but something is better than nothing. So try to get as much as you're able to. Okay. All right. So that's going to be it. Any questions for me?
For icing, I know you don't want me on my stomach. Do I sit up with the ice against my back?
I would recommend, icing it against your back. Yeah. So I don't want you laying on your stomach. The reason why is because when you're laying on your stomach, so like let's say you're facing away. This is you looking this way. When you lay on your stomach, what tends to happen is you lay and your head twist. When your head twists, you're going to put a lot of strain onto the joints here. This is where a lot of chronic belly sleepers, when we take an x-ray, a lot of times their spine will look like this, where your neck, it will twist and the spine will shift with it, okay? And so this is why if you sleep on your side or on your back, that's the best position because you're taking a lot of the stress off of the spine. But if you sleep on your stomach, that twist puts a lot of strain there. And usually it doesn't happen to cause a lot of stress in the beginning, but I've had a lot of patients. I've had patients where they literally sneeze and their neck goes out. And I asked them, like, do you sleep on your belly? Like, that's the only type of position I sleep on. And that's where it puts a lot of the strain and the stress there. Okay, so if you can, lean up against something on your back. On a recliner is probably the best for you, just because it helps to take off pressure off of that lower back. But yeah, that's probably the best position for you. Okay. Any other questions?
That's it.
All right, good. Well, I'm glad that you're here. All
Me
right,
too.
good. Are you feeling doing okay?
Yeah, I'm doing good.
Good, good, good. All right, well, you're all set. We'll see you then next time. And then keep up the good work from here, and then we'll see how things are progressing as time goes on, okay?
Okay.
All right.
Okie dokies.
Have a good day.
Thank you, you too.
Bye.
Thank you. Bye-bye.